We see the struggles that cancer patients face. We know the hardship this disease creates, and we are determined to help provide support to those impacted. We know cancer disproportionately impacts Black, Indigenous, and people of color in many ways. As a leader in the cancer community, we see the burden cancer delivers, but we are aware we do not understand every person's experience.
Our goal today for this event is to start an important discussion that will lead us to strategy for our cancer community, a plan that we all can take part in to help those when they hear the dreaded words, "You have cancer."
You know, cancer is the disease that affects everyone, but it doesn't affect everyone equally.
For every single basic need we asked about, BIPOC respondents reported that they were always or often struggling to afford these more than their white counterparts.
If you're a person who does not have the financial access to pay for drugs or to pay for treatment, then it can easily cause a person to have a lower quality of life as they navigate through cancer.
We have to center race, in particular in the American experiment, understanding how central and intentional race was used to build the foundations and the institutions and the organizations that we all now sort of operate within.
When we're educating providers, we shouldn't be just reminding them, hey, any women under 45 need to be referred. We need to specify oftentimes that African American women get missed, so make sure you pay special attention to those patients so we're not missing any of them.
It becomes very challenging, especially when we have to talk to a patient about palliative care and hospice. So not giving treatment to somebody, but actually withholding it, and that's the best thing for them. And we see that very commonly, that those discussions are much more difficult in our BIPOC communities. And it's because of that underlying mistrust from systemic racism that it makes it very difficult. It takes extra time and patience to do that, and not everybody takes it.
Oftentimes in every visit, someone asks me, how much is this going to cost? And I have had patients say, oh, that's not in my budget. We shouldn't be there when we're talking about things like how we're going to treat someone's cancer. Someone shouldn't have to make decisions based on the cost when really we could prevent them from having a second diagnosis, or we could screen them in the future from other types of cancer.
We talk about equity, even defining what that is presents a challenge. And across the sector in general, like it's turned into a partisan conversation, and it's a human problem, not a political problem. It's a human rights issue.
And that really goes into the idea of equity rather than equality. So not necessarily just treating every patient the same, but making sure the ones that are systemically disadvantaged, we treat them in a way that brings them up to the level of the ones that are systemically at an advantage.
So I am thankful to organizations like the Angel Foundation and American Cancer Society who have been a resource and help. And at the same time, hope that there are people on this webinar today that will be able to help people remove barriers and create more equitable policies that we can make changes and improve outcomes for all people, regardless of ethnicity, and provide quality of care.
It's so important that when that patient walks in the room or that patient is on the phone, they immediately feel like they belong here.